Hello everyone, I hope you're well and having a good day. So in today's video I just wanted to summarise a few of the key points from this week. I know we're still continuing to issue quite a lot of messages and it's often hard to keep up with some of the information, so I thought it'd be best just to summarise some of it today, and obviously if there's any questions that you wanted to ask then feel free to send them through. So as I said earlier in the week, we've now launched some new COVID information pages just for Trust colleagues, which are on our public website. The pages are hidden and can't be searched for, but the link is pinned to the top of the staff Facebook group, so you can have a look through there. You don't need to be on the Trust network or using remote access service to see these pages, so hopefully having access to them in this way will make it easier to find the information that you need. Obviously if there's any issues then just please let us know and we can help you along with those. So we continue to work through the health risk assessments. It's still a major area of focus for the incident management team, and I know that some people have still been waiting for the outcome of their assessment from occupational health. So we've now got 3 extra occupational health nurses specifically dedicated to this piece of work, all based with the occupational health team, and extra administrative support as well, just so we can speed up the response time. So to date we've had 524 of the health risk assessments undertaken and submitted, so there's still quite a lot to get through, but I do know that we're now starting to see some of the information come back from occupational health, so that you can then have that conversation with your line manager about coming back into work. So again, just please bear with us, and we are working to try and resolve some of these issues as quickly as possible, and I'm confident we'll get there over the next few days. So as I said earlier, it's really important that once you receive that response from occupational health, you need to contact your line manager and go back into your assessment and update it. So that's in light of the advice provided by occupational health. Obviously then that conversation with your line manager, agree what the next step should be in terms of working arrangements, and come up with a plan that covers any adjustments or support that you'll need. Your manager then will sign off the health risk assessment to ensure that it's finalised, and obviously we can then hopefully see you back into the workplace somewhere. There's more details on this, but it was in my written message on the 7th of July, or the new staff information pages on the Trust website. And obviously you can re-access your health assessment by using the link included on the email that you would have received when it was completed. As I said, obviously if there's any questions then please let us know, but we are working through the assessments as quickly as we can do. So I also talked earlier in the week about international travel and also annual leave. Obviously we've shared the government guidance for international travel, and we know that there's a list of countries you can travel to without the need to self-isolate for 2 weeks on your return. Obviously, as I said earlier in the week, this is the UK's guidance, and if you're intending to travel outside the UK, it is important you check the corresponding country's guidance, so the country that you're visiting, as they might have different rules in place. Also worth noting, as we stand here today, there are some countries that are not on the UK list, and if you travel to places such as Portugal, Sweden or the US, there's still a requirement for you to quarantine for 2 weeks when you get back into the UK. And to do this, we'd still be asking you to take annual leave for that 2-week quarantine period, and this applies to all colleagues across the organisation. We've had some queries about whether the quarantine arrangements would apply to clinical staff, given some of the information included in the government guidance. And so just to confirm, we understand that this guidance relates to clinicians coming from overseas to start employment in the NHS, and not to clinical staff taking holidays and returning to work. So in summary, if you travel to a country outside of those with no quarantine arrangements in place, you'll need to self-isolate and take an additional 2 weeks annual leave. So annual leave is really important. If we lead on to that now, really keen that you make sure that any annual leave request you pick up with your manager as quickly as possible, so we can get those requests approved, obviously in line with service need, and make sure that you've had those conversations with your manager before you book any trips. Really do want people to take annual leave wherever possible. I mentioned in my message earlier this week, everyone's been working really hard, and we really do understand that it's important to get some rest. So we just need to balance up those requests with service need so that everyone has a chance to take a break. What I do know is obviously that'll be very bespoke and different for each service. I know we've got some services where it's really difficult for people to take annual leave, and some services where it's probably a bit easier. The message though, the stance is we're encouraging you to take your annual leave, and we're doing a piece of work at the moment just to see how much annual leave people have got and how much of the year is left to go, so that we can get that annual leave booked in wherever we possibly can do. If for any reason it's not practically possible for you to take that leave, then the COVID guidance a couple of months ago did suggest allowing people to carry over 4 weeks worth of statutory annual leave from this year to the next financial year. That said, as I'll restate again, we want to encourage people to use their leave for this year. Otherwise, obviously, we're going to store up problems for the years ahead. So please take some time to look at your leave requirements, speak to your manager, try to take some holidays if you possibly can do, and obviously just read that guidance about the different elements of international travel and the restrictions from the UK and into the country that you're travelling before going abroad. If there are any questions around annual leave, please speak to your manager, but equally if there's any questions you want to ask me or anyone in the incident team, then please let us know. So finally, we're looking ahead now, lots of planning around winter, which is a bit odd given that we're in July, but we are starting to planning for winter, and particularly the flu season. There's lots of discussion nationally about the need for a major flu immunisation programme to try and offset some of the risks of COVID-19, as obviously both respiratory conditions and potentially a huge issue if we have a spike in coronavirus cases at the same time as we're treating people with flu. So we are working up a plan for our trust flu vaccination programme this year, and it will be obviously an essential part of us trying to protect colleagues across the organisation from a health and wellbeing point of view, but also protecting wider family members, carers, etc. So we have ordered enough vaccines for every member of staff, and we are hopefully going to see a further increase in the number of people that get vaccinated this year. Given the situation with COVID, really encourage people, once we start to get the flu vaccination programme started, encourage people to get that flu vaccination undertaken. We're probably going to run the flu vac programme similar to what we've been doing with the pop-up clinics, learning sort of the lessons as to how they've worked really well. So once we get a bit more information on those, probably after the summer, then we'll let you know, but I'll keep you up to date as things progress over the next few weeks. If you have any ideas about the staff vaccination programme to make it more effective, then please let us know. I'm sure we can pick up on some of your ideas. So that's it from me for this week. I just wanted to give you a quick update of where we are with things like the cases and so on. We do now have one positive case of COVID-19 on one of our wards, which is obviously a change from the last few weeks. Obviously we'll keep an eye on that and see how that progresses. We are still seeing a small number of decreases in the number of colleagues who are away from work with a COVID-related absence. That's down to 66, so it's making good progress there. And obviously we're keeping a close eye on all of our wards just to make sure that everything is okay. It's clear that we're not in the same position here in Derbyshire as the City of Leicester, and Ifty's made that clear in the figures he quoted in his after the weekend note on Monday, and that still remains the same today. But we do need to stay obviously aware and vigilant. We need to ensure that people continue to wear PPE, follow the guidance appropriately, and really need to make sure that we practice social distancing and good infection prevention control, so such as washing hands regularly and thoroughly. So all the things that you've all been doing, that we've all been doing over the last 3 or 4 months, and doing it really effectively, so we just need to continue doing that. So yeah, that's it from me for this week. I will speak to you all again next week, and hopefully you'll have a good weekend. Thank you.